This video is part 3 of Chapter 9, Single Case Research Designs for PSY 222, Research Methods in the Psychological Sciences. In part 3, we're going to be looking at what are called multiple baseline designs, which is another type of commonly used small n design. It's used in order to deal with the ethical dilemma that I was talking about at the end of the part 2 lecture, where you have ABAB designs that, because of ethical reasons, returning to baseline is just not seen as morally appropriate. So what you do in a multiple baseline design is instead you don't return individuals to baseline. Instead, you are able to demonstrate the effectiveness of a treatment by having more than one baseline change following introduction of the treatment. And I will pause here and say it can be confusing if you're just talking about these designs. I find that it's really helpful to look at the example that your authors provide for you in the chapter. So I'll just pause here and say, remind you, look at the examples in the chapter as you're thinking about these designs to help yourself make sense of them. So in procedural terms, what you're doing is to establish several baselines, and this could be specific behaviors, and implement treatments on one baseline at a time, and then you compare behaviors. You compare between the treatment and the baseline stages, establish, instead of having to take the same individual and then apply the treatment, remove the treatment, apply the treatment, which creates the ethical dilemma. What you can do is you can create baselines that are across situations, such as having, say, a child in a grocery store, in a restaurant, and at home. You could do it across behaviors, such as use of place names or use of object names, use of asking words, use of declarative statements, or you could do it across individuals. But what you're doing methodologically is you're able to take these different baselines, apply treatment, and then see if you see the same kinds of changes across the different kinds of situations, behaviors, or individuals. Now, some of the examples that you're given, you could say, look at playing with peers as the behavior that you're interested in. You could establish a baseline, and in this case you're describing, say, a child that is not playing with peers at all. And then you have a treatment approach that's applied, and you see the increase in play behavior, playing with peers. That's the first behavior of interest. Then you have meeting adults as the second behavior. And this is the same individual and the same type of treatment. So baseline, no meeting adults behaviors. And then after the application of the treatment, you see an increase and a leveling out of that behavior. And then you have ordering in a restaurant. My guess is that the behind the scenes, this example is a child with social anxiety, for example, and you are doing some sort of cognitive behavioral technique to encourage these socialization behaviors that can be very anxiety provoking. So in this case, your multiple baselines are across situations. You have playing with peers, meeting adults, ordering in a restaurant. The same type of treatment is applied, and it has demonstrated, if you look at these plots, improvements in behaviors across situations. And that allows the researcher to say, this is a treatment that has efficacy across situations for this individual. Now let's say you're a researcher and you do several of these with several individuals, and the same kind of pattern appears for each of those individuals. That adds additional evidence that your treatment approach is effective. Now, how do you interpret the findings? And I've kind of foreshadowed this a little bit. If the treatment is effective, what you're going to see is that the behavior, in fact, appears to change when the treatment is applied. Now, from the images on the previous slide, what you wanted to see was an increase in the behavior. The reverse could be true. It may be a behavior that you want to get rid of or reduce substantially, such as self-injury behavior or disruptive behavior. Regardless, if the treatment is effective, you want to see behavior change when the treatment is applied. And you would, in some cases, depending on what you're doing, you may select a behavior that is different and shouldn't respond to this particular treatment. And you would be able to show by comparing, and this would not be the case in the image that I showed you on the previous slide, but in some cases you would want to show that a particular treatment is targeted to a behavior of interest, but shouldn't have an impact on other behaviors. So let's say that you have a disruptive behavior that you want to get rid of, but you want to maintain other positive behaviors. So you apply a treatment to reduce the one behavior, and it shouldn't have an impact on the others. So the treatment is effective if you don't see a change in that behavior from the remaining baselines that you're comparing it to. In the other case, and this would reflect the images from the previous slide, you would see that the behaviors change only when the treatment is affected. So when the treatment is applied, rather. So on the images on the previous slide, what you see is that across situations, when the treatment is applied, the behavior changes. And depending on the particular way that the researcher has designed it, you're going to interpret it, depending on that specific design. The behavior should change if you're going to be able to infer that the treatment is effective, that the behavior change appears on the plot directly after the introduction of the treatment. It doesn't appear to be creeping in before the treatment. It doesn't appear after a substantial delay after the treatment has been applied. An example that you're given in your text of a multiple baseline design approach would be a behavior intervention approach to manage classroom behavior for a child that has disruptive classroom behaviors. So let's say the child doesn't stay at the desk, blurts out questions, doesn't remain quiet at quiet times, and so on. So your goal, if you are the behavior therapist, is to reduce these disruptive behaviors. Now, one approach could be to use very obvious rewards or positive reinforcers, such as tokens or other kinds of rewards that the child believes are tangible. And perhaps the therapist is targeting desired behaviors, such as sitting quietly, such as waiting your turn to talk, being quiet during quiet times, and so on. And the rewards are given for those behaviors that are the opposite of the behaviors you want to disappear. In technical, I think, behavioral terms, it's called counter-conditioning. If you're doing this across behaviors, the first behavior is leaving the desk. For the first 2 days, you make baseline observations, and what you would see on this image is first couple of days, you got high levels of desk leaving behavior. Then on day 3, you start to add reinforcements, tokens, for staying at one's desk. So when the child remains at the desk, they get a token. Starting day 3, you start to see more desk time, even more desk time at day 4, my bad, less desk leaving. So you could interpret that as staying at one's desk more, less desk leaving, even further declining on day 4, even less leaving your desk on day 5, less and less and less. A little blip on 9, but you're still leaving the desk far less with the application of the tokens that started on day 3. So what you see here on this graph is that the behavior that you want to decrease has in fact decreased with the counter conditioning approach. Now what about the second behavior, blurting out questions without raising your hand? For the first 5 days, they did baseline observations. Treatment was implemented on day 6. And what you see in the graph is that with the treatment application at day 6, you do see a marked decrease in blurting out answers. So basically what was rewarded, what were tokens given for? Raising one's hand and waiting to be called on before answering. And those tokens, giving those reinforcements, decreased blurting out answers, as you can see on the graph. And then you have the third behavior, not quiet during quiet times, baseline for 7 days of observations, implement the treatment on day 8. And if you're talking about you might be asking yourself, why are the baselines different lengths of time? There could be a lot of methodological reasons for that. It may just be an artifact of what kind of access the researchers had to the child. It could also be so that you are staggering the application of the rewards at different times. And like with the other examples, with our third behavior, you have 7 days of baseline where you see quite a lot of loudness during quiet times. So that's the behavior you're wanting to counter condition out. So reinforcements were then started on day 8, which is right here, and you see a marked decrease in the problem behavior of being loud during quiet time by giving rewards for being quiet during quiet times. Now we could extend this graph out for several days where you would see the continued decline and maintenance of that behavior. Some ideas that you need to keep in mind when you're thinking about multiple baseline designs. You have to ask the question, how many baselines do I need? Typically you're going to have a minimum of 2 different baselines. What's often recommended is you have 3 or 4 running simultaneously. Second, you have to be aware, if you document on your graph that behavior changes before the treatment, you're going to have difficulties with interpretation, because if your treatment wasn't applied but you see an improvement in behavior, you have to find out what was happening in the situation that may have sparked that change in behavior. Is it just a natural developmental change? Is there something else going on in the situation that prompted that change in behavior? If the behavior starts to shift before you've applied your treatment, then you have a problem interpretation-wise. What if the treatment generalizes to other behaviors? So let's say that the child that we were working with in the example has an aha moment and says, you know, all these things I've been getting in trouble for in class, I've noticed that when I sit still and stay at my desk, I get rewards. I wonder if maybe if I do this other thing that my teacher's been complaining about forever, I wonder if I'll get rewards then too. If that happens, then you'll have to modify the research design in order to deal with that kind of transfer before you can determine whether or not the treatment itself is effective. It doesn't mean that it's a bad treatment. If it generalizes, that means you've got a treatment that teaches a more global kind of skill. And if it generalizes across situations, more power to you. But from an interpretation standpoint, you're going to have to be careful to think about how you're going to interpret the impact of the treatment approach that you're applying. Now, some problems with all of the methods that are described in this chapter. Sometimes behaviors that you are documenting at baseline, sometimes those behaviors can be highly variable. And that's what we call an unstable pattern of baseline behavior. That means, if you have some days you're recording high levels of the behavior, other days you're recording low levels of the behavior. If those behaviors are up and down and kind of all over the place, it can be really hard to detect an interpretable change in behavior. So what you may have to do is, in your documenting the baseline, and this is another alternative for why there might be different lengths of baseline time. In the example that I was working with earlier, it may take 6 days or 7 days or 3 days or 2 days for a behavior to stabilize. And that's how, researchers using these small n designs may have to, wait until their baseline shows a reliable picture of the baseline level of a particular behavior, especially if that behavior is highly variable. So you may have to wait for the behavior to stabilize. Sometimes you don't have that kind of time to wait, but that is an issue that you'll have to plan for if you're going to use a single case design. Also, if you're trying to interpret increasing or decreasing trends in a particular behavior, the effects of a treatment can be hard to interpret if you're not seeing a really, really clear pattern. The images that I've shown you in this presentation, it's obvious what's happening and it's very easy to interpret. In real life, that may not always be the case, especially if you're dealing with real people. People are messy and their behaviors are sometimes unpredictable. So trends, interpretation is going to really depend on whether or not the trend is in the predicted direction, and if it is a stable change. If you have lots of variability, or if the trend goes in the opposite direction as what you were predicting, then you have an interpretation problem. Some examples of challenging images, and this comes straight out of your text, so I encourage you to visit the section where your authors are referring to these images. But these are all relationships between intervention and behavior that are going to be in some cases difficult to interpret. So the arrow marks when the intervention was started. In the first image, in image A, the intervention is started and there's a gradual increase in the behavior of interest. And in that case, let's say it's a positive behavior and you want to encourage it. Interpreting image A is fairly straightforward because your baseline behavior is a pretty straight line, and then you have a steady increase. So if what you were aiming for was an increase in behavior, then that's what you get, and it is marked by the start of the intervention. Now in image B, though, you have a fairly erratic baseline with a substantial decrease right at the point when you start the intervention. Then you have a steady increase. What the interpretation challenge would be, is the baseline, is this pattern, can you actually draw a straight line through this? You have ups and downs, a big valley, then the intervention is started, and then you have an increase. There could be multiple interpretations of that pattern. Here you have a similar problem in image C. You have a steadily declining, not steadily, but a slowly declining baseline. Then the intervention is started and you have a steady incline. You may be left wondering, why was the behavior declining at in the first place? And then the intervention, was the intervention actually effective, or was it just re-supporting a behavior pattern that was present to begin with? In image D, here you could, there are a number of different interpretations. You don't really have a baseline that you've established. There's a steady decline in the rate of the behavior that you're interested in. Applying the intervention at this point is kind of meaningless because you just have a continued steady decline in the behavior. That means that you haven't really established a baseline yet. In image C, you may have been on the road to the same kind of problem where there was this decline in behavior. You perhaps hadn't waited long enough for the baseline to become evident before adding the intervention. So there are lots of things to keep in mind. Multiple baseline studies, especially clinical intervention studies and behavior therapy studies, it takes a great deal of skill and practice to learn how to do these types of designs. So they're not something that you just want to jump into without a great deal of experience. Myself, I wouldn't do a multiple baseline because I don't have the training at the present time. Luckily, I know people who do. So if I ever found myself in need of using such a design, I would go to an expert to give me the training that I need. Now, there are some problems with these small n single case designs in terms of generalizing the findings beyond the single cases that you're looking at. Obviously, they're powerful techniques in terms of being able to demonstrate the impact of a manipulation on an individual person's behavior. However, you have the same problems with these single case experiments that you do with case studies. You're just looking at individuals. Individuals are unique, and just because you can show a transformative effect of a treatment for one person doesn't mean that that effect is going to generalize to other people. So this is a problem of external validity, a problem of generalizability for us if we're using these designs. So what do you do about that? Since you're dealing with external validity challenges, you need to really document the degree to which your treatments have a powerful effect. If that's the case, then you should be able to take the method, test it with multiple people, and show that the treatment is still effective to the same degree. But that does require that you move on from a single case to looking at using the same single case design, but doing so with multiple individuals, sequentially, probably not simultaneously. Multiple baseline designs can be useful in helping you to demonstrate external validity. So if you're using the token reward system, for example, to increase positive behaviors and counter condition away from negative behaviors, if you do that with multiple behaviors in the same individual, you're demonstrating in a specific way the generalizability of that treatment approach. Group treatments are a way that you can further, your authors are very fond of multi-method, the multi-method approach. If you do group treatments, you can also demonstrate how effective a given treatment is likely to be across individuals, and that can boost your external validity. And that concludes my video lectures for Chapter 9.